I'm dealing with two different diseases. However, one was the cause to the other. So one of them, and the first, is adrenoleukodystrophy. This is genetic disorder, and it is we can say adrenal. It is related to the adrenal glands. Leuko related to the white matter or the myelin sheath that cover the neurons in the brain and the neurons of the spinal cord. These neurons that we can say that they are related to the transmission of the electrical signals from the brain to the whole body. These neurons are covered by white matter for protection. And then the dystrophy, because there is a problem or degradation or something like that. Okay, now in our body there is something called very long chain of fatty acids. It has a specific benefit, but if it is or accumulated, it causes problem. So at the same time, there is ALDP, which is a protein that transfers the very long chain of fatty acids to the peroxisomes in order to be broken down and to be at the good value all the time. However, the patients who have adrenoleukodystrophy are missing this protein. They don't have ALDP. So the very long chain of fatty acids are accumulated. And when they are accumulated, they target three places or locations. First, the adrenal glands, and let them stops its function from producing the cortisol, aldosterone, and DHEA. Second, targets the myelin sheath or the white matter in the brain, so it deteriorates the white matter and let the neurons being uncovered, so the brain is separated from the whole body gradually. So as for example, one of the symptoms that can cerebral symptoms that can start that the patient is not seeing well. There is a problem in his vision, and when he go to check his vision, it's okay, his vision is okay. So in this case, he should go to a neurologist and ask for MRI in his brain, because there might be something wrong in his brain, either adrenoleukodystrophy or any other leukodystrophy disease, which are more than 55 diseases. Okay, so another symptom could be related to the hearing loss, and another one to the speech or the balance or behavior issues like ADHD or ADD. A lot of symptoms related to the brain and the whole body, the electrical signals from the brain to the whole body, and we don't know which symptom appear first. By the way, some of these can be seizures also. It can be related, and for the teachers or the educators should be notice if any of the kids having has a specific handwriting, and then his writing became like clumsy and strange. He should highlight this or raise this to the parents to check with a neurologist or to check the brain. So this is the cerebral form, or the when the very long chain of fatty acids accumulates and target the myelin sheath of the brain. The third phenotype, when it targets the myelin sheath or the white matter of the spinal cord. At this case, it causes problem with walking and stiffness in the legs, and also urination problems and bowling problems. As I said, then we have three phenotypes. The first, the cerebral, is the most severe one, and around 40% of the ALD kids will have the cerebrum form at some time between the age of 4 and 12, but it can be less than this and more, but I'm saying this is the more common. And for the male ones, okay. And the second phenotype related to the spinal cord, it is called AMN, or adrenomyeloneuropathy, which is can happen to the adult male ALD patients from age 18 and after this and later, and also for the ALD female carriers like me at their 40s or 50s. And the last one, the adrenal insufficiency, which is the mildest one. It mostly happens to the ALD male, all of them, mostly, or like 90 or 80% of them, and 1% only from the ALD female carriers. Going to the adrenal insufficiency, there are three types. Adrenal insufficiency meaning that there is a problem in the adrenal glands if it is primary adrenal insufficiency. So we have three types of the adrenal insufficiency. The first, primary adrenal insufficiency, which means that the adrenal glands themselves are not working. They are not producing their hormones. And it is chronic disease. The patient will live on hydrocortisone for life. And the second one is the secondary adrenal insufficiency. This means that there is a problem in the pituitary gland, which produces the ACTH that call the adrenal glands for producing or secreting the cortisol hormone. Because this is like a loop. We have the hypothalamus in our brain that whenever the body needs cortisol, which is the whole 24 hours, our body is producing cortisol, but by different levels. In the early morning it's very high and going lower until 4 p.m. Then it coming a little bit high, then it goes lower until, for kids, 10 p.m. it is the lowest, like 50, something like this. And for the older people or the adults, until 11:30 or 12 midnight, it is the lowest. And then started to getting higher from 1 a.m. or 2 until it gets higher, the highest or the peak at 6 or 8 a.m. So when the body needs the cortisol, what happens? The hypothalamus in the brain produces CRH, corticotropic releasing hormone, which goes to the pituitary glands and tell her, okay, produce the ACTH to call the adrenal glands, the ACTH, which is called adrenocorticotropic hormone. So the adrenal glands go and produce the cortisol hormone and its essential hormones. So when there is a problem in the adrenal glands itself, the ACTH will be high because the pituitary glands is calling the adrenal glands by this ACTH, but this is in vain. So primary adrenal insufficiency or Addison's disease, ACTH is high and cortisol is low. While the secondary, this is the primary, the secondary adrenal insufficiency, where the ACTH is low. So there is a problem in the pituitary gland, and so it can't produce the ACTH. The problem is not at the adrenal glands. This can happen because of a tumor at the pituitary glands, or because of taking glucocorticoid treatment for anything like, for example, asthma for a long time, and then stopping for one time. So it happens, a shock is happened to the body. The hypothalamus and the pituitary gland are feeling that there is cortisol in the body, so no need for the releasing hormone or the adrenocorticotropic hormone. So the adrenal glands don't produce the cortisol until the patient stop this treatment. So the body with no cortisol and also with no CRH and ACTH in order to call the adrenal glands to produce the cortisol. And this is what happens. And most probably, if this is the reason, mostly the patients can be treated and recovered from it. It's not chronic, but it takes long times. It can reach years, where the doctors will prescribe the hydrocortisone high dose, and then start very, very gradually and slowly to reduce or wean the doses until making the test or requesting the ACTH stimulation test or synectins test, in order to make sure that adrenal glands return to produce the hormones. And just a note, if this happens and the doctor told you, okay, you can stop now the hydrocortisone, everything is good, make sure you can be cautious, because whenever you have any illness or sickness or anything that you used to stress dose, I think you can ask your doctor, consult him and say, shall I take stress dose after this or not? Because even if you stopped, still the adrenal glands will not be functioning fully efficient in order to bear any stress, at least at the very beginning from stopping the hydrocortisone. And then the tertiary, which is the last one, it is a problem at the hypothalamus. So these are the three types of adrenal insufficiency. The primary adrenal insufficiency, like 85% or 90%, the cause is autoimmune disease. Okay, however, there is like 10 or 15% other causes. One of them is tumor at the adrenal glands. One of them, and the others are different genetic disorders like AAA syndrome, like CAH, congenital adrenal hyperplasia, or adrenoleukodystrophy.